I'm Pinky Webb. Today on the program, the country breaches the 60,000 mark on confirmed COVID-19 cases. Also, are we on track in our target to flatten the curve? And what else can government do to prevent the further rise of infections? Health reform advocate and former COVID-19 task force advisor Tony Leachon joins us in the program. The country has surpassed a previous prediction that it will record 60,000 COVID-19 cases by the end of July. The national tally now stands at 61,266 with 21,440 recoveries and 1,643 deaths. A group of experts from the University of the Philippines earlier said the country will reach 60,000 coronavirus cases by the end of July. The UP researchers also said the number of cases may reach as high as 130,000 by the end of August, adjusting an earlier prediction of 95,000. Meantime, Malacanang says the country saw progress in flattening the curve early in the coronavirus fight. But presidential spokesperson Harry Roque says everything changed when the lockdown was eased. Let's go straight to the source of the story. Health reform advocate and former COVID-19 task force advisor, Dr. Tony Leachon. Dr. Tony, good to see you again. Welcome to the show. Thank you for your time.
Good morning, Pinky. Good morning.
So, Doc, the country now recorded 2,498 cases, and I believe this is the second biggest number.
Yeah.
And that brings a total to 61,266 cases. Is this alarming to you? Or is this alarming, or is this really the trend that you expected? Because government keeps saying we have been targeted testing and we have been contact tracing.
Well, this is really alarming because in the last 7 to 10 days average, it's about 1,500. And last night, it was the second highest recorded in terms of your new and active cases in a day. Well, of course, with the increase in the number of testings, you expect that the positivity will rise. We have a target at about 1% of the population, about 1 million patients to be tested. But the WHO normal value or recommended value is less than 5%. Our positivity rate is right now 11 to 12%. So it means there are really active cases, and it's not merely because of the testing process.
The UP prediction was 60,000 by the end of July. We've obviously surpassed that, and the date is July 17. And while UP experts were proposing that we shift back to a stricter MECQ, the president kept Metro Manila under GCQ. Doc Tony, you were there last Wednesday with the president. I was quite surprised to see you there. What were you doing there?
Well, I was surprised too. I was invited a day before, and I even called up the executive assistant of the office of the president to clarify whether I was really invited. And I was really invited. And then the lady actually told me to submit any slides or any materials for the president for that particular briefing. So I was there.
What did you tell the president?
Well, of course, the president was with a group of 10 key opinion leaders, basically to ask on our recommendations, on the quarantine recommendations, on other inputs in order to solve the crisis. So the UP group came in first with Professor Ranjit saying that the recommendation would be MECQ because if we were on GCQ for the last 2 weeks or so or more, and we see acute cases, that would not be okay. But according to Secretary Anyo and Secretary Galvez, the Metro Manila mayors lobbied for a retention of the GCQ. So during my turn, I told the president, if I would decide this based on my clinical acumen as a physician and not thinking, of course, of the economy and the social amelioration funds, I would perhaps suggest an ECQ pattern after the first ECQ in March, I think March 15 onwards, and in Cebu, because clearly there's a rapid acceleration right now of the cases. That's number one.
Mm.
Number two, several hospitals have actually declared full capacity already. Number three, two healthcare professionals died in the last, I think, few days, and it's starting, so it might be a sign already.
Mm.
Number three, we have surpassed Singapore right now. I think we're number one, by the way.
Yeah.
We surpass Indonesia right now in terms of active and new cases, and we're the number one in terms of the lowest recovery rate. So these are telltale signs that we are not doing well in terms of arresting the viral transmission. So I would say we have not yet really flattened the curve here.
Yeah. I want to talk about flattening the curve a little later on because that's something really we need to understand. Is it a simple graph when we talk about flattening the curve? So you said, Pangulo, balik natin sa pinaka-strict na ECQ. Sabi ng UP experts, let's go to MECQ. But of course, we're at GCQ now because sabi nga ni Secretary Galvez and Secretary Anyo, according to Secretary Roque, they wanted to retain the present status. What kind of scenario, Doc Tony, are you looking at now that we are in the same status as we were in the past months?
Well, it's nice to review history kasi we tend to repeat it. We tend to repeat mistakes kung hindi natin pagbabasihan yung nangyari in March, no?
Mm-mm.
If you remember, 30 doctors died there. That's number one. Then number two, talagang acute yung cases natin, ang dami. We're struggling there to save a lot of patients. And with that, because of the acceleration, we extended our ECQ. Now, ang different scenario right now, kaya gusto ko sanang ECQ, para let's say 2 weeks lang, since we have already some of the infrastructures in place,
Right.
like let's say the testing center, the
Right. The
isolation and
quarantine
quarantine.
facilities. Yeah.
Yes, and then you have three new SARS for each of these
Correct.
particular. Yeah. So if you will hammer it using the hammer and dance concept, just 2 weeks, hammer it
Uh,
down rather than a conservative GCQ, right? And then build up the healthcare capacities, right? And give a timeline of 2 weeks. And then after that, because in Cebu, the reproductive number was 2. Then after 3 weeks, according to the UP group, it went down to 1.2. So therefore,
mhm,
the ECQ worked for Cebu.
mhm.
So since we have a bigger problem right now kumpara sa Cebu,
Yeah.
ang suggestion ko sana i-hammer na talaga ng ECQ.
Okay.
Since ang middle ground MECQ, but we finally settled as a group, as a team for
So
GCQ.
we're sabi po ni Secretary Roque, we're being given almost like a 2-week grace period. He didn't use the words grace period. I'm the one using that. Pero parang titingnan natin anong mangyayari sa susunod na dalawang linggo. Kumbaga parang this is very telling what will happen in the next 2 weeks. What are you seeing happening? Because I wanted to ask you that because of all the factors that you mentioned. And very important, Doc Tony, yung ilang mga ospital have reached full capacity. The fear is if you're saying we're gonna go back to the March April time, that was the time, sir, na ang dami ng kaso at na-overwhelm yung mga ospital at nagkasakit po at namatay yung mga health workers.
I think dapat they have to review it day to day. Kasi very alarming eh. Bigla na tayong number 1 sa Asia in just 2 days. Dati number 2 tayo to Singapore. And in just 2 days, number 1 na tayo. Ganun kabilis yung problema.
Yeah.
And the problem is not naman you can just turn around the corner. You have a big problem here kasi ang laki ng space eh. Kaya ang suggestion ko nga dyan, ECQ, kaya lang, mangangailangan ka ng SAP. So, zonal lockdowns lang. That's why in, I think, certain areas, mayroon ka mga tank doon, may mga militarization to control the behavior. I'm not sure, but they need to review it daily or perhaps on a weekly basis and not wait for the 2 weeks in terms of
Mm-mm.
their revisions in the area classification of the quarantine.
Yeah. Especially, Doc Tony, umabot nga sa 2,498 yung recorded cases as of yesterday. And then there's even this prediction by Octa, dapat nga, di ba, 60,000 by end of July. This has been actually revised to 130,000 at the maximum cases by the end of August. Where do you see this going? Indeed, Kung dyan po tayo mapunta, can you imagine 61,000 cases now? Kung, parang dodoble siya by
Yes.
the end of August.
Bine-base kasi yan sa mathematical and actuarial analysis and
Yeah.
then sa run rate And I think totoo yun Kasi as we see right now, kung 1.5 ka or 2,000 ka, talagang mahihigitan mo yan. Ang ibig sabihin lang yan, dalawang bagay. The first nakikita ko, our current strategy is not working. Kasi kung nag-work siya, di dapat okay siya. Then number two, ang question mo ngayon, what particular strategies that can arrest the transmission? Kasi remember, kaya overwhelm yung healthcare system mo kasi marami kang active cases Eventually, madadali niya yung mga vulnerable patients to enter the hospital. But very expensive mga hospital ang moderate and active cases, only 15% of the population. So I think the strategy right now is to go to the preventive side, which is the bigger pie, which is about 85%, and put all your money there and, of course, all the infrastructures related to that. You have to prevent it para hindi ma-admit sila in the hospital.
And meron po kayong pinropose? Did you propose anything to the President regarding preventive, sir?
Yeah. Ang una nag-present, with due respect to Dr. Edsel Salbanya, tama ho siya. So he presented treatment. And then while presenting, actually I had it mine and Roddy. There were presentations on yung mga antiviral, and then yung mga ventilators, and then mga low-flow cannula. Pero pag kinumpute mo, it will be in the millions or billions for treating 15%. Not that we don't want to treat them, no? But then, meron siyang figure showing that the totality of your face mask, your face shield, hand washing, and your social distancing is 90% in arresting viral transmission. So I was thinking, akala natin hindi nagbe-behave yung mga mahihirap. And when I asked them sa clinic yung iba, and in the streets, pagkain nga walang mabili, mask pa kaya So if they want to wear mask, then we have to provide access. So dapat libre natin ang mask, particularly sa urban poor, because the middle class and the upper class can afford it. And perhaps then yung private and public partnership program should zero in on the preventive side. Kasi minsan, nadodonate yung PPE. That is on the side of the curative. Mahal yun ang curative You don't want them nga ma-confine Ang second suggestion, alam mo ba Pinky, ang testing in many areas variable and exorbitant. Like say one hospital 17,000, may 15,000, may 10,000, may 14, may 4. The lowest is San Miguel 2,500. Red Cross may 4,000. So ibig sabihin, in other countries libre ito So if let's say the urban poor magiging libre sponsored by the LGU. Like kahapon, I was going home, nakita ko dun sa may City Hall, ma-traffic doon, but that's a good problem. Kasi libre just like yung sa Korea, meron kang, drive-through.
The drive-through,
Drive-through and libre, not only for National Capital Region, but people who would want to be tested. And that's a good sign. And I think Tagig as well, Tagig yata, no?
Meron din po sila.
So these are good. These are good moves And my last suggestion, sabi ko, I think ang Indonesia and Philippines kaya sila mataas because they're archipelago. It takes time for the virus to go after one region. Like say for example Manila and then nagpunta ng Cebu because people will travel.
Correct.
Ngayon hindi katulad ng isolated and landlocked cities. Pag tapos na yon, okay na. So tanong mo tapos na yung iba. Tayo pa lang ng Singapore hindi. So my suggestion is to treat the Philippines, let's say 80 provinces, 80 countries. Just like when sinabi ni Lee Kuan Yew na gusto ng China maging Singapore, then you have to divide China into 1,000 Singapore. Now, for those hot areas, they have to use the hammer and the dance. Let's say Manila and Cebu. But for those peripheral areas na naka-MGCQ kayo, you have to start dancing right now and create the infrastructure for detection, isolation, so that when the virus will come dun sa inyong area, ready na kayo.
Handa kayo,
Handa kayo, katulad ng ibang countries. Sabi ko, there are poor countries, Mr. President. Myanmar, Cambodia, Vietnam.
Vietnam,
Zero
yeah.
death sila, ang bababa because they started early.
Right.
They did their contact tracings early in time.
Right. But because tapos na po yun, nandito na po tayo ngayon. So sabi mo, the next 2 weeks will be basically crucial, but we need to look at this on a day-to-day basis, wag every 2 weeks. So when you said that the number one, the most basic thing is to wear a mask, you proposed this to give it free, especially to the siguro
Urban poor.
urban poor, sir. Was there any reply to that, sir?
Yeah, sabi ni Mr. President kay Secretary Duque, i-compute nga for the Manila, kwento si Secretary Duque. Kasi for 20 million, ang kwenta niya at 15 pesos, 300 million. Sabi ng Presidente, oh, if we cannot afford that as a country, ano pang reason nandito tayo? We can well afford it. So ibig sabihin yun. And then last night, I received a text from Senator Bongo kasi nandun siya. Meron siyang press statement right now na alluding to this particular issue. So, nag-respond tayo kasi we want to arrest the cases eh.
Yeah.
And hindi naman natin pwedeng paghiwalay-hiwalay talaga nasa squatter. At least there's one protection. Nakamas sila.
Yeah. Okay. And you you agree with this, Oplan Kalinga? Yung po
Yeah.
kukunin yung mga positive na mild or even asymptomatic at dalhin sa quarantine facility kung wala silang sariling palikuran at kwarto.
Yeah. Isa pa, nalaman ko from my daughter-in-law who works in San Miguel. Alam mo, may care kit sila. Pagpasok mo doon, maghuhugas ka ng kamay just like in the OR. And then they were given care kits with 5 masks. Tapos libre ang alcohol. So ibig sabihin at the middle class level, hindi totally libre. But we will give you at a discounted rate. So ibig sabihin, people are thinking right now eh.
Yeah.
But middle class yun. How about the poor? Ang poor ang cost ng local transmission natin. So we have to address this.
Yeah, maybe it's good possibly that government really look into that. Just very quickly, Doc Tony, please help us understand really this flattening the curve. Of course, Secretary Duque said we flattened the curve, and then he said he retracted and he said we actually bent the curve. If I were to tell you, sir, if I look at the graph, mine is a simple graph. On the left side, you see the number of cases, and then dito po sa ilalim ay yung mga dates, ano po. So sa akin, nakikita ko lang siyang a curve or a rise, or maybe sometimes bumababa. When do you say that a curve is flattening? Because when you talk about it, there are other factors, according to the government, that you need to consider. The case doubling rate, mortality rate, etc., sir. Critical care capacity. Sa kasama ho ba talaga yon pag sinabi nating flattening the curve?
So it's a bell-shaped curve. Ito yung number of cases eh. So therefore, yung nire-report ng Department of Acute Cases, that determines it, the cases. Now, ano magpa-flatten yan? Kung bababa ang cases mo with healthcare capacity, kasi yun ang ginagawa yung buy time eh. Now, there are many parameters, but yung minention na mga doubling time yun, okay lang yun. But kahit na ang doubling time natin malayo, hindi tayo na-flatten ng curve eh, based on the John Hopkins eh. In fact, step ladder tayo eh. Ang right term in April, because Secretary Duque approached me at pinakita natin ng curve. I think, ang sabi niya, parang wrong choice of words siya. Ang dapat kasing term after the ACQ in March, in April, is actually plateauing. Totoo naman eh, nagpa-plateau. Kaya lang, with the onslaught in Cebu, nagkaroon ka ng step ladder. So, itsura na natin ganon. Kapag ganon. And then, kinorek niya bent. Pero hindi bent downward eh. It's actually bent upward siya eh. Kasi yung ganyan ang curve na natin eh. So I think yung choice of words niya, yun ang naging problema. I think that's also the statement of Secretary Roque about the wrong choice of words.
Right. So pag sinabing flatten, Doc Tony, pag tinignan po natin, at there has to be a period of time na parang nagfa-flatten po siya talaga.
Yeah, so I'll explain.
How long should that be?
Okay.
Kasi you can flatten for 3 days, tapos bigla umakyat, bumaba, hindi ho ba?
They usually in the Hammer and Dance concept by Thomas Pueyo, yung social writer na naka-invento nitong concept na to. When you buy time at nagawa mo healthcare capacity ngayon, it's about 3 weeks. Ang range 3 weeks, you can actually flatten the curve to 7 weeks. That's why ang binibigay natin dapat sa government is about 2 months eh. So there's no wrong time to do the right thing. The second time around of the 100 days, if we will focus on healthcare capacity, we can achieve that in 100 days. Kasi ang run rate ng lahat ng countries in Asia, like China, South Korea, except Indonesia and Philippines, lahat sila na-flatten ng curve in 3 months eh. That's why in the artificial intelligence of Singapore, ang prediction nila na after the ACQ natin, July 8 tayo flatten ng curve eh. But there are things na hindi natin kagad na-accomplish eh. So we can accomplish in the next 100 days if we will focus on the metrics really to flatten the curve. So ganito yan, Pinky, the bell-shaped curve, and there must be an extinction or termination of the wave para sabihin mo siyang flatten. Ngayon, pag pababa lang siya, it begins to flatten, ang tawag dyan deceleration phase. Pero ang tunay na flatten, magpa-flatten ka. And then, pagka nagkaroon ka ng second wave, after extinction, ang tawag dyan second wave.
Right, okay.
Yeah, that's why we don't have a second wave, because we don't have extinction of the first wave.
But have we had deceleration?
We had deceleration na sana nung April. Kaya lang, because nagpabaya tayo ng konti in terms of our social distancing and hindi nga natin na-address yung mga face mask na yun. Tapos sumabay yung Cebu sometime in the first week of June. Umakyat uli. So gumanon siya. Nakadagdag siya.
All right. So as Dr. Tony Leachon is saying, these 2 weeks will also be very critical for us to look into and siguro the situation, and of course government, as Dr. Tony Leachon was saying, that should look into the situation on a daily basis instead of every 2 weeks. Dr. Tony Leachon, sir, maraming salamat po sa inyong oras.
Thank you very much, Pinky. Pleasure.
Thank you, and thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.